Ever felt a pain so sharp, so persistent, it feels like an eagle's beak digging right into your jaw or neck?
Oof, that doesn't sound pleasant.
Definitely not. And for people with Eagle syndrome, that's the unfortunate reality.
It's a condition that can really throw doctors for a loop, and for good reason.
Right, it's not your everyday ache and pain. So we're taking a deep dive into this medical mystery today, going through some research you sent us to uncover what makes Eagle syndrome such a tough nut to crack. But first things first, for anyone just tuning in, what exactly is Eagle syndrome?
Well, imagine this. You've got this bony little protrusion right under your ear called the styloid process. You've actually got one on each side. Now, in Eagle syndrome, that styloid process is either like way too long or the ligament connecting it to your hyoid bone. That's the bone that helps you swallow. Gets all hardened or even calcified. It's like this chain reaction of discomfort.
Ah, I see. So that's where this whole eagle beak idea comes from.
Yeah.
But why would that extra length or a hardened ligament cause so many issues? It's not just about the bone itself, right?
You hit the nail on the head. Think of it this way. That extra length or that hardened ligament, it starts pressing on all the nerves and blood vessels in your jaw and neck, and bam, that's when those weird and often really debilitating symptoms start cropping up.
And those symptoms can be all over the place, right? It's not just a simple, oh, my jaw hurts kind of
You
thing.
got it all.
What are some of the things people are actually experiencing?
Oh, people with Eagle syndrome describe all sorts of things. Jaw pain that comes and goes, earaches that just won't quit, even this feeling like something's stuck in their throat.
Wow, I can only imagine how uncomfortable that must be. No wonder getting diagnosed can be such a pain, literally. It's like your body is sending out mixed signals.
Exactly. And to make matters even trickier, these symptoms can look a lot like other more common conditions. So Eagle syndrome often flies under the radar and gets misdiagnosed.
That must be incredibly frustrating for folks going from doctor to doctor trying to figure out what's going on.
Tell me about it.
Hmm.
And unfortunately, all those misdiagnoses can lead to treatments that aren't even needed, adding even more confusion to the mix.
Okay, so we've got these mysterious symptoms that often get mistaken for something else entirely. Now, let's talk about what sets this whole chain reaction in motion in the first place. Our research mentioned that for a while they thought tonsillectomies were a major culprit. What's the story there?
Yeah, that was one of the early theories. The thinking was that scar tissue from a tonsillectomy might somehow be messing with the styloid process.
So they thought removing tonsils was somehow messing with bone structure. Okay, I'm sensing it wasn't quite as straightforward as that.
You're right, it turned out to be a bit of a dead end. While tonsillectomies might play a small part in some cases, research shows it's not the main event.
So what are the main culprits then? What causes some people to develop this whole eagle beak situation?
You know, it's still a bit of a medical head scratcher. Yeah. But we've got some solid leads. One possibility is chronic tonsillitis. So basically frequent or long-lasting inflammation in the tonsil area.
So even without having them removed, just dealing with tonsillitis could be a factor. Makes sense if you think about it. All that inflammation in one spot, it figures it could affect nearby bones and ligaments over time.
Exactly. Your body's trying to heal, but sometimes that healing process comes with a few unintended consequences, right?
Right.
Another big factor is any trauma to the jaw or neck.
Like whiplash from a car accident.
Hmm.
Or even just a bad fall.
Exactly. That kind of impact can actually cause the stylohyoid ligament to harden or even mess with the styloid process itself.
Wow, so something that seems totally unrelated at the time could actually increase your risk down the line.
It's true. Our bodies are really good at remembering these things. And of course, we can't forget about genetics.
Ah, yes, the good old, it runs in the family.
Precisely. Some people are simply genetically predisposed to having a longer styloid process, which naturally puts them at higher risk for Eagle syndrome.
Okay, that makes sense. But here's what I'm wondering. If some people are just born with a longer styloid process, why don't they all have these symptoms?
That is one of the most interesting things about this condition. It turns out having a longer styloid process doesn't automatically equal Eagle syndrome. Lots of folks are walking around with elongated styloid processes, living their lives, totally oblivious to their eagle beak.
Hold on, so you're telling me I could have this unusual bone structure going on and never even know it?
It's totally possible, and that's what makes diagnosis such a pain, no pun intended. It's not enough to just look at an x-ray, see a long styloid process, and call it a day. Doctors really need to look at the whole picture medical history, specific symptoms, and what they find during a physical exam.
So how do doctors go about diagnosing something as seemingly elusive as Eagle syndrome? It sounds like a real detective case.
It does often require a bit of medical detective work. It usually starts with a good old-fashioned physical exam, and this is where things get interesting. Doctors will actually feel around the back of the throat near the tonsils, trying to, palpate or feel for the styloid process.
Okay, well, I'm all for getting answers. But I gotta say, having someone poke around back there doesn't sound like the most comfortable experience.
I mean, it's definitely not the most fun you'll ever have, but it can be really telling. If pressing on that area brings on that telltale pain we've been talking about, especially if it shoots up towards the ear, big red flag for Eagle syndrome.
Right. Makes sense. I guess you're basically pushing on those irritated nerves and ligaments we talked about.
Exactly. Doctors might even try numbing the area with a local anesthetic. And if that gives the pain a temporary timeout, well, that further points to Eagle syndrome.
So that's the hands-on part. But I'd imagine technology plays a role too, right? What about imaging?
Imaging is key. X-rays are usually step one because they can show the length and position of the styloid process. But sometimes you need something more heavy-duty, like a CT scan, to really see the surrounding tissues and spot any potential nerve or blood vessel compression.
I've even heard about cases where Eagle syndrome is discovered by pure chance. Someone's in for a routine dental x-ray, and boom, there it is.
Happens more often than you think. It just goes to show sometimes these medical mysteries pop up when you least expect it. Even a simple dental x-ray can hold the key.
Speaking of mysteries, let's talk solutions. Let's say you are diagnosed with Eagle syndrome. What can be done? How do you manage those symptoms and actually find some relief?
Well, the good news is there are really effective treatments out there, both conservative and surgical. And for a lot of folks, those conservative approaches are enough to keep things under control.
So starting with the least invasive options first. Sounds like a plan to me. Tell me more about these conservative treatments.
One of the most common approaches is medication. Simple over-the-counter pain relievers like ibuprofen or naproxen can help with inflammation and pain. And sometimes doctors might prescribe something a little stronger, like muscle relaxants or prescription pain meds.
What about things like physical therapy? Could that help with Eagle syndrome at all?
Absolutely. Physical therapy can actually work wonders. Specific exercises can help strengthen those jaw and neck muscles, improve posture, and just generally relieve some of that tension that might be making things worse.
So it's not just about treating the pain itself, but also tackling any muscle imbalances that might be contributing to the issue.
You got it. It's all connected. And in some cases, doctors might recommend steroid injections or long-acting anesthetics injected right into the problem area. These can really help knock down inflammation and offer some much-needed, long-lasting pain relief.
Okay, so those less invasive options sound pretty promising for a lot of people. But what about when conservative treatments just aren't cutting it?
That's when surgery comes into play.
Okay, so let's talk about the surgical side of things then.
Yeah.
What does that actually involve for someone with Eagle syndrome?
The main goal with surgery is to basically shrink down that elongated styloid process, take some of the pressure off those surrounding nerves and blood vessels.
So it's like they're going in and surgically shortening that eagle beak.
Exactly. Give everything a little more breathing room.
That sounds intense.
It is a delicate procedure.
Yeah.
But there are two main approaches surgeons can use depending on the specifics of the case.
Okay.
One involves going through the mouth, kind of behind the tonsils, to get to that styloid process and shorten it. The other option is making an incision in the neck, behind the jaw.
I am not usually one to squirm, but both of those options sound a tad invasive. Are there benefits to one approach versus the other?
For sure. Going through the mouth is definitely considered less invasive. No visible scar, usually a faster recovery time.
Right.
But going through the neck, that often gives the surgeon a better, clearer view during the operation, which, can be super important when you're working in such a sensitive area.
Yeah, no room for error there.
Yeah.
So with either approach, what are we looking at in terms of fixing the problem?
That's the encouraging part. Both surgical approaches have a really high success rate in relieving those Eagle syndrome symptoms.
Oh, that is encouraging.
Now, obviously, any surgery comes with some inherent risks, right? Infection, bleeding, things like that. But experienced surgeons are incredibly careful to minimize those risks. And the good news is that serious complications are pretty rare.
That's reassuring.
Yeah.
So for anyone listening who's thinking, wait a minute, this Eagle syndrome, this sounds a lot like what I've been going through. What's the takeaway? What should they do?
The most important message is this. If you're dealing with this pain jaw, ear, throat, and it just won't quit, especially if you've got those other strange symptoms we talked about, don't brush it off.
Right. Don't just try to tough it out.
Exactly. Talk to your doctor and Don't be afraid to, really advocate for yourself. Ask all the questions. Push for more tests if you need to. Don't settle for a diagnosis that doesn't feel right.
Exactly. You know your body better than anyone.
Absolutely. Early diagnosis and treatment are key. That's how you manage Eagle syndrome and keep those symptoms from taking over your life.
This has been a fascinating deep dive. We went from, like, Eagle syndrome, what even is that, to really understanding this unusual condition. Thank you so much for walking us through it. I feel like we all learned so much.
Happy to do it. I always love digging into these lesser-known medical conditions.
And for our listeners,
Hmm.
if you ever stumble across something that piques your curiosity,
Yeah.
you know we'd love to explore. Until next time, stay curious, everyone.